We'll now move on to Mrs. Heran. You are the Director General for the Ethiopian Food and Drug Authority, EFDA, of the Federal Democratic Republic of Ethiopia since 2018. Those of us who have worked on tobacco control in Ethiopia know very well how essential it has been in the passing of the law. What role can women in the governmental space like you play to elevate tobacco control and contribute in building a healthy and tobacco-free nation?
Thank you very much, Bintou, and thank you all for the opportunity in sharing the experience of Ethiopia and how we managed to get into a very strong law which was approved by the House of Parliament in February 2019, which is one of the strongest laws in tobacco control. And this has also been acknowledged by the World Health Organization in 2019. And Ethiopia has gotten recognition by World Health Organization 5 times, starting from the ratification of the Framework Convention for Tobacco Control. In terms of affecting tobacco effect on women, because women, they bear a disproportionate burden of secondhand smoke exposure, which is also attributable to around 2.18% deaths in 2017 alone, and majority of the burden is concentrated among women and children. And while tobacco use among men is gradually decreasing, it's increasing in African countries in terms of prevalence of smoking in women, and also in the European region also there is a slower decrease in smoking in women. And the tobacco industry is targeting women in terms of increasing the smoking prevalence. They are aggressively targeting women and girls with advertising that exploits ideas of independence, empowerment, slimness, glamour, beauty, and all those kinds of targeting women, especially and adolescents and the young population. They are bringing themselves and they are branding themselves as bringing alternative solution, making themselves as a solution provider. And from observations and studies and research, there's a big gap between very focused industry experience in targeting specific population, sex and age group, and there is a big gap between the tobacco control policies. There's a gender-blind policies in tobacco control, and because of this, policies are missing a key determinant, not only of risk but also of effective interventions. So we need to focus on industry interference, new products coming in like the e-cigarettes, flavored e-cigarettes, which are targeting women also. Ethiopia has banned these products entirely, according to our proclamation. And the e-cigarettes are very addictive and harmful, and they are modifiable, and mostly they are being used among non-smokers, adults, young population, and so on. So because women are the economic engine, they need special attention in health agendas. As caregivers in the home, they are an important resource. Policies need to target special needs and special problems of women, and including the cessation activities as well. So women leadership, women empowerment is very important, because nobody can tell the world globally about our needs and problems. So they need to engage in policy formulation, in legal framework design, research, and evidence as well. The tobacco industry is targeting women, and they are targeting women freedom. So we need to focus on freedom from smoking rather than freedom to smoke. And state parties also should involve women in planning, implementation, monitoring of policies, programs, and services affecting women's health. And women in leadership position also should include research and science. Fortunately, in Ethiopia, 50% of the cabinet ministers are women, including our health minister, also Her Excellency Dr. Leah. She's an advocate for tobacco control, and she's highly engaged in our regulatory works as well. So we are very fortunate that women are leading the country in terms of policy making, in terms of framing legal frameworks and advocating for tobacco control. So we need to promote policy and program formulation, implementation and evaluation that incorporate gender lens, especially focusing on women. And we need to implement, monitor, and evaluate gender responsive actions in different mechanisms of tobacco control. So we are planning now in Ethiopia to develop a new national tobacco control strategy for the next 5 years, which will be including very gender-specific issues, which includes gender-specific risks according to the Convention Article 4.2d, and also interventions also specific to women as well. So thank you very much, Bintou. Over to you.
Heran, every time I'm in your presence, I've got chills because, I know the fight that you've taken on a few years ago, and I know your determination to get this law well implemented. What you've done today is told the whole world who's listening to you that you're going to make this happen. So we're all watching, and we all look up to your leadership, Heran, and we wish you good luck. And we are all here to support you and to root on you. So please don't give up. I think the last points that you made about empowering women at all levels and in all fields is really important.